You're tuned into The Joe Show on AFN the Eagle, the station that serves America's best. I'm C-Dub, and I have two very special guests joining me from the Regional Health Command Europe. I have Colonel Sarah Breckenridge-Sproat, and I also have Major Justin Miller joining me. Hi, how are you guys?
Hi, C-Dub.
Hello.
Thanks for having us.
Well, I'm so excited that you guys are joining me. You know, we've been talking offline about New York and milking cows and stuff like that, but that's not what we're talking about today. We're talking about some really cool work that you guys have been doing in a place that we may not really realize that we're working in. Isn't that right? We're talking about the Ukraine.
Thanks, C-Dub. I would love to talk a little bit about it. Did you know that a major conflict between Russia and Ukraine has been occurring within about a 2-hour flight from here?
That's amazing. And that's scary to think.
Yes, ma'am. And I also find that the more I work in Ukraine, the more I learn about the strategic importance of such an amazing country. NATO and Ukraine have had a relationship that dates back to the early 1990s, and it's developed into one of the most substantial of NATO's partnerships. It's a really critical geography to the Euro-Atlantic security stability. Did you know that Ukraine is the only partner country that's contributed to every NATO-led operation and mission?
Oh, I did not know that. That's really interesting.
It's in a very important place, not only geographically, but the partnership that we have worked with Ukraine. And since the conflict really began in 2014, cooperation has increased in many critical areas. To include, the Ukraine has sought NATO support to transform their legacy of Cold War conscript massive type forces into a smaller, more professional mobile force. With this in mind, really over the last couple months, we've done a lot of medical capacity events to include the two we're here to talk about today, the Surgical Masterclass and a Basic Leadership course.
And speaking of the Surgical Masterclass, Major Miller, you participated in that. Now, can you talk a little bit more about it?
Yeah, C-Dub, I sure can. So the Canadian-Ukrainian Foundation is a NGO, non-governmental organization who goes to the Ukraine to help the Ukraine medical structure change from that old Russian model to a more current model, more current like ours. Currently, their model is very physician-focused and physician-led, where their providers do everything from start IVs to doing administration work. So what they're wanting to do is adapt the way they provide health care to more of a United States model. So the Canadian-Ukrainian Foundation came to us and requested a nursing expert to come and help. So that's how I got included. So many of the injuries they had seen were cranial and facial injuries and people with hand injuries as well. We were doing a lot of those type of surgeries. Many of them were very, very memorable for me. So we saw people with hand contractures from burns, people with cranioplasties, which is where part of their skull was removed to make room for their brain when it was swelling. So a couple of these patients did not have that part of their skull anymore. And what we did is we placed a titanium plate there to protect the brain. The plate also helps with the mechanics of their eye and their jaw, and to also improve their appearance and their self-confidence. One thing that I will never forget is the patient who woke up after this cranioplasty, looked in a mirror, huge smile on his face, and said, "I'm handsome again."
Oh, wow. That's amazing. Now, let me ask you, why do you think doing these things are important?
So, as a clinical person, so I've been an Army nurse for 29 years, and I joined when I was 5, of course. One of the things we look for are ways to learn from each other. Especially as clinical folks, we like to work together, side by side, learn from each other in a mentor-mentoree sort of way. We like to work on patients together, and that's really how clinical information is often passed. So for us, that's an important way of treating shoulder to shoulder with these Canadian NGOs and also with our Ukrainian counterparts. Really, it builds a relationship, a professional clinical relationship that happens to also contribute to the NATO alliance.
And we're back on the Joe Show on AFN the Eagle. I'm C-Dub, and I still have my special guest joining me from the Regional Health Command Europe. We have Colonel Sarah Breckenridge-Sproat, also Major Justin Miller. Are you guys still there?
We are.
Sure
Thanks,
are.
C-Dub.
Well, we're glad that you're joining us. We've been talking about a very special mission that you've been a part of. Now, Colonel Breckenridge-Sproat, let me ask you, the second trip to Ukraine was for the Basic Leadership course. Can you talk a little bit about this and what all it entailed?
Be happy to. So Justin talked a lot about the clinical role of an Army nurse, and the other side is we are also an officer. So what we're trying to do is start a culture cultural change from the bottom up. So we selected officers who were junior in rank and some senior NCOs, and we began with a curriculum based on our direct commission program that we have in the Army Medical Department. So we take nurses, physicians, chaplains, and turn them into Army officers, that dual role I was talking about. So we made the curriculum based on that, and the basic instruction really centered around trust, shared Army values, and progressed deliberately over the week to a role-playing exercise where then they turned and demonstrated the concepts that they learned during the week. We also wove in some NATO overview. We had a Hungarian officer who joined us, and really that was a key element. Having other former Warsaw Pact countries was important to show from a cultural perspective that change is possible. And the final event of the week was a roundtable with Lithuania, Hungarian officers, as well as a UK and US leaders. That is important because it can't be a US-led future. It needs to be a Ukrainian future. And so for us to really culminate in a week of sharing the values that we expect of other NATO countries that we work alongside, it was incredibly fulfilling.
Sure, absolutely. Well, you know, on the show, we talk a lot about Strong Europe, and this is a perfect example of Strong Europe right here and working with our NATO partners.
And this course really builds the foundation. So you have to start with an individual before you can build a team or expect them or anyone to function at a level. You have to share what your expectations are. So this really built the foundation of what can be Ukraine's future.
Absolutely. And I loved what you said. You've got to start with the individual, because that's true. You know, each individual is going to have a certain role, and you're only as strong as each individual is on the team. So that's a great example. Now, what sort of feedback did you get from the participants?
So what they, at the end of the week, what we did was we did a comprehensive, what we call AAR, after action review, where we asked the students, what would you improve? What would you sustain? The comments that we got back were really fulfilling. They were very hungry for this content. And they also said, you know, no one's ever really listened to us. You know, it might be sort of the same thing you would hear from somebody in junior rank in any organization. It was important for their voices to be heard. They appreciated having open, transparent conversations about real problems and real solutions. They also appreciated that, you know, we didn't come in with, this is the American way, this is the best way. We came in with, this is a way. There's also a Hungarian way or a Lithuanian way. You tell me what Ukraine's way is going to be. At the end of the class, you know, the students were tearful of how great the class was, and many hugs, and we traded patches, and I'm really hopeful that these students took this to heart. We even had some say, I was forced to be here, and I'm so glad I came because I never expected it to really be as great as it was.
You're tuned into The Joe Show on AFN The Eagle, the station that serves America's best and has been serving America's best for 75 years. So we actually have some of America's best hanging out on the phone with me. We have Regional Health Command Europe's Colonel Sarah Breckenridge-Sproat, as well as Major Justin Miller. How are you guys doing?
We're great.
Awesome.
Well, how about you, Justin? Are you
happy to be here with you.
Well, thank you very much. So we've been talking about a special mission that you went on to the Ukraine, and I have to tell you that this has been so amazing listening to it. You know, we talk about Strong Europe on the Joe Show basically every single day because that's what it's all about, and we're talking about this mission that you went on. Tell us why it was important for Regional Health Command Europe to go to Ukraine and actually to go back to the Ukraine.
Sure, C-Dub. As clinical folks, we learn from one another. We have clinical expertise. However, because of the current conflict with Russia, they have significant patient acuity. So both of us learn from each other, and we think that that is part of a big important piece of what this surgical masterclass gave us. Not only did it give us the opportunity to share expertise or current techniques, but also it's good for us to see that sort of level of acuity.
Absolutely. And I think that working with our NATO partners is so important on every single level.
I agree with you that being the relationship building is one of the key pieces. So when we go to war, be that in Afghanistan, you look over and you see a fellow NATO person that you've worked together with when you're not in a current conflict. That relationship builds and builds. We have strong ties with, of course, the UK, Canadians, our Germans, and it's really about that relationship building. And as clinical people, we bring another layer of that relationship, and that is the care of a patient together.
Is there anything else either of you would like to add?
Actually, C-Dub, thanks for asking that question, because Justin and I have been talking a lot about what we see as the future and hope for Ukraine, and it is about that building relationship. But one of the things that struck both Justin and I when we've been there is that this is a stoic, firmly dedicated to democracy country. This is a really prideful people dedicated to their freedom. And for Justin and I, it really resonated with us when we thought about
how the United States went through this about 200 years ago with the revolution. So just fighting for something that they absolutely the Ukrainians are fighting for something that they absolutely believe in for their future. And what they want to make their country.
Well, thank you guys so much for joining me today. I've really enjoyed having you on and learning about the mission in the Ukraine. Now, if our audience wants to learn more, or if they missed any part of this, where can they go to find out more information?
Thanks, C-Dub. We really enjoyed being here today and sharing a little bit about what we're doing in Ukraine. It's such important work. Whenever anyone has any questions, I usually refer them back to the USAREUR website. The U.S. Army Europe website will have active links to things that are going on in Ukraine and in this area of operations. It's really a way to keep fresh information accessible to all your users.
Well, that's wonderful. Well, thanks again for joining me, and I hope you come back next time.
Awesome. Thanks for having us.
Thank you.